Hello. In my presentation, I am going to explain how marijuana is a gateway drug. First, I'm going to start off with a personal story. When I was 7 years old, marijuana definitely affected my life, but not me personally. It affected my mother, who was using marijuana basically her whole entire life. She still is using it to this day. That has affected me to be put into foster care and to be taken away from my mom. Marijuana was my mom's first drug she ever tried. She tried it, she used it, still uses it, and marijuana did not fill her need for how high she wanted to be. So my mother would use methamphetamine and heroin and other stronger drugs that would substitute marijuana because marijuana was not as effective to her anymore. When I was about 15, I came to realize that marijuana is not as safe and as helpful to someone who does not use it medically. It has a lot of effects on the brain. I'm going to move to my main point, and that is what marijuana is and how it is used. Marijuana is a greenish gray flower, but it's dried. It is a plant that is grown. From history.com, it tells you how it is grown and how people how it became in the history of behind it. Marijuana can be used medically and recreationally. It can be smoked in many ways. It can be used in tea. It can be used in food. This plant contains more than 500 compounds of chemicals, including more than 100 compounds that are related to THC. Now, let's talk about how the effects of marijuana has on someone. The National Institute of Drug Abuse says there are good effects and bad effects of marijuana. The bad are that it can make someone have anxiety. It can make them have fear. It can make them have distrust into somebody, and it can make them panic. People who use larger doses experience like hallucination, delusion, and loss of their sense of personal identity of who they are. The good effects are some people do get relaxed from marijuana. They are calm, and you get hungry when you use marijuana. So that can be good and bad. Eating a lot if you're using it on a daily basis. Now let's talk about how it can be a gateway drug. When people began using cannabis while they're young, their young brains are still developing, which can be in their early 20s. It can change the reward system of their brains. Like other drugs may turn into becoming more appealing to them. Like I said in my story, marijuana was not appealing to my mother anymore. It wasn't satisfying her. So my mother became addicted to meth. My mother became addicted to heroin because those are stronger chemicals that are going to affect her brain. A 2015 study, users that use marijuana, about 50% of them went on to use harder drugs. So far we've talked about how marijuana affects the brain and how it can be a gateway drug for someone. Statistics on how many people use other drugs after marijuana is not like as high as someone would think. Because marijuana, it does help with medical, it does help with treatment and stuff, but other people that have used it not medically and not prescribed to them are using it in the wrong reason. So that's why it's not an 80% other people are going to use other harsher drugs. But more than likely, if you are using it for recreational, other drugs may become appealing to you. So I just wanted to let others know that marijuana is not as safe as many people think to someone who is into drugs. It's definitely not like something fun to do. Oh, all my friends are doing marijuana, so I'm gonna do it. And it's just not safe on your brain, and all the chemicals are not good for you.